Hello, I'm China Terrell, and I'm here with Maritza De Jesus, the Chief Administrative Officer and Director of Human Resources of West Side Community Health Services. We're going to learn a bit about West Side Community Health Services and the wonderful work that they are doing and have been doing in the St. Paul community since 1969. Maritza, welcome to All Things Access.
Thank you.
So tell us a little bit about what is West Side Community Health Services?
Well, Westside Community Health Services is an organization, an ambulatory care clinic. We provide a variety of services, mainly to improve the health of disadvantaged populations or within the St. Paul area and throughout the state, actually. We do that by building responsive programs. We enhance our capacity, trying to grow the clinic so we can see more patients, and we serve as a voice for the communities.
Mm-hmm.
Our mission is to serve, to care for the health of diverse communities.
Mm-hmm. And how did Westside Community Health Services get started?
Well, Westside Community Health Services started in 1969. It was started by a group of Latino and Anglo members, and they were offering preventive health care services for Spanish-speaking residents of St. Paul West Side.
Mm-hmm.
And it has grown from, we were seeing 1,900 patients, and it has throughout the years, going on 36 years, we serve about 35,000 patients.
So from 1969 to 2008, tell me what it is that speaks to you personally about the mission of West Side Community Health Services.
Okay, I think, for me personally, because I grew up in a house that predominantly spoke Spanish, my parents never learned how to speak English. And so my mom, there was many times I would go to all the appointments with her when she went to the doctor, and they would try to explain to her what was wrong or what was aching her. And I remember how frustrated she would get, because it's very hard to understand what the provider is trying to tell her, for her to even express her pains or exactly what was wrong. And I had an opportunity 3 years ago to join an organization that was providing that service the way that I'm sure my mother would have appreciated and would have loved to be able to come to the clinic and see people that spoke her language and doctors that could actually understand, what her needs were.
And so how many ethnic communities does West Side Community Health Services serve? So for example, Hmong or Somali?
Well, we predominantly see a large portion of Hmong, Asian Hmong primarily, but other Asian also, and Latinos from all over Latin America, South America, and Somalis is a growing population, and basically we don't turn anybody away. So.
And there are translation services for each of those groups?
Well, within our organization, 60% of our staff are bilingual and bicultural. So many times we don't have to go outside to get any resources. Every once in a while we may get a language, an Asian language, which we don't know, so we'll use outside interpreter services. But I think what draws people to our organization, to our clinic, is that they have a place where people can understand and what their needs are.
What about the range of services that's provided? I understand that there is specialty care, primary care. Could you tell us a little bit about that?
Westside has lots of services, and we have 2 dental clinics. We also have 10 high schools where we provide healthcare services within those clinics. We also have 10, we have a homeless, it's called Healthcare for the Homeless, which are 10 drop-in centers. And within those, we provide primary care, preventive care. We do education around diseases, disease management. We talk about OBGYN, mental health. We also have wraparound service, because some of our patients can't get to our clinic. We do have a van which we utilize to pick up some of our patients to come in for group sessions or for appointments. We give out tokens and vouchers if they have no other way of getting to an appointment. So, we pretty much have social and wraparound services that tries to meet all their needs, because they're very specific to the population.
And then what's unique about West Side Community Health Services, West Side Community Health Services philosophy in providing this care? So for example, what makes West Side unique in how they go about providing that care?
Well, I think what we try to do is that we try to look at sort of different populations have different needs, and so we try to build our services, and when we seek out funding or whatever we want to bring within the organization, it's because it's driven by the needs of the organization. In our organization, there's I would say a large group that are obesity is a problem, diabetes is a huge issue as far as really knowing what kinds of foods to eat and understanding nutrition. So we offer a lot of those services within our organization with our nutritionists and our dietitians. We have a doctor that specializes that with our diabetic patients. We monitor their progress. So I think we try to look at what are those things that within each populations is probably something that is not being addressed anywhere else.
So targeting the specific needs of the various ethnic communities and
Right.
providing both education and service.
Exactly.
How does Westside Community Health Services survive financially?
Right. Well, we are a federally qualified health clinic, so we do get some funding from the federal government. We get some local funding from the state and government. Some of our patients do have insurance. We have sliding scale fees, so based on the ability of people to pay, they get put on a sliding fee, and then another portion of that obviously is donations that we collect. So.
Well, thank you very much, Maritza, for joining us today. And I understand that if you would like to know more information about Westside Community Health Services, you can certainly visit their website, which I have visited and is very informational and helpful and also bilingual. The website is www.westsidechs.org. www.westsidechs.org. Thank you so much for joining us today.
Thank you very much.